We're now joined by Rick Scott, the chairman of Conservatives for Patients' Rights, to discuss rationing.
Grover, thanks for the opportunity to be here. My background is I've been in the healthcare business for years. I started a hospital company, built that up. I had hospitals all across this country and in Europe, and I saw absolute rationing of healthcare. We had 4 hospitals in London, and if you went and visited other hospitals in London, you could see how pathetic the facilities were, and you could talk to patients and see how they didn't get care. So one of the first things we did this year was we put together a documentary, and we hired you can get a copy outside, and if you don't get a copy, just email me. But what we did is we hired Gene Randall, who was an anchor from CNN who had gone freelance, and he just talked to patients and doctors, and I'll give you some quick stories. Katie Brickle, 19-year-old girl, says she's in college, says, gosh, it's time to go get a pap smear test. You get it in the United States and most countries at the earlier of 2 years after you're sexually active or at 18 years old. She's 19. She goes, the primary care doctor says, no, the government says you don't get it until you're 20. She goes back at 20. 2 primary care doctors said, no, the government just changed the law to 25, so you can't get it right now. She goes back at 23. She's got cervical cancer, and she probably has a year to live. She's 25 years old now. Another example, Dr. Sikora, who's an oncologist, he'll tell you, and you can get a copy of this and you can get on the website, Faces of Government Healthcare, and look at all these interviews. He says, if you're 70 years old, we don't even tell you all your treatment options. We know the government won't pay for it. You get breast cancer. In this country, you generally can get Avastin if you need it. Over there, nope, it costs too much. Debbie Hurst, 55 years old, gets breast cancer. She can't get it. And so she starts doing a bake sale to see if she can even pay for it out of pocket. It was against the government regulation to do that. They've recently changed it, maybe. But the only reason she got it is because she got a story in the New York Times. The next day, the government gave her Avastin. There's a story about Don Neufeld. He had heart arrhythmia. He lives outside Vancouver, Canada. It took 20 months to get an appointment with a cardiologist. And he's in the ER almost once a month, almost dying. So he had to come to the United States to a hospital down in Oklahoma City to get care. So there's no, if you look at any country that has government health care, they ration it. Now the way they ration it is they always run out of money because governments always overpromise everything. So what do? They do exactly what everyone's talked about. They underpay doctors. So if you're a doctor and you're underpaid, what are you going to do? Are you going to say, gosh, this is the career I want to have, or I'm going to do more of this? No, you're going to do less of it. So we have more limited access all the time. So the best example is we've already talked about is Medicaid. How many doctors want to take care of Medicaid? 1, it's the reimbursement. 2, you're right, it's the hassle factor. So we have rationing of health care. We're going to continue to have rationing of health care the more government we have involved in the system. I would ask everybody to take the time, whether you want, this is 28.5 minutes, watch this, get on our website and look at all the different interviews, and then talk to people in other countries. Don't rely on us, but talk to people and tell everybody the problem with government health care, that your kids, your daughter, your son, your parents are not going to get the same health care they get today. Thank you very much.
Explain the website for people watching this on TV.
The website is, you can get on, the easiest is facesofgovernmenthealthcare.com. And what we have on there, you have all these, there's probably 9 different interviews with doctors and with patients, and it just tells about the problems of getting health care in those countries. Thanks a lot.
Rick Scott, that's facesofgovernmenthealthcare.com?
Yes.
On the website, okay, to get that.